So this is part 2, and of course you can see the kind of material that she was laying on to stabilize the tibia. And you can see my finger indentation there as well. So we worked for 5 minutes to glide her femur forward. And now we'll see if we discern any difference there. This feels a little freer to me. I don't know if you feel a difference.
Yeah. Pretty close.
The mobility of the patella, I can't say that I discern a difference there. Let me get underneath it, try and squeeze, and I don't really note a difference there. And now I'm going to test AP glide. So I take up the slack in the whole system, okay? And you can see that I can now take up some slack. You can see the lower leg move. And so I just hold it for a little while just to optimize tightening up all the tissues around that joint. And now I impart a little spring. And you can see that not only does it move forward, but it also recoils. So I feel like we did change that. Out of curiosity, let's have you lie on your stomach and bend that knee. And on your stomach with feet off the edge, please. And I'm now wishing I had done a precise measurement. Just relax and try and let me do the movement, okay? And in my opinion, this is greater. Your thoughts?
Feels like it is.
Yeah. Before I wrote in your note that it was about 10 inches away, so it was in the region of here, you know, somewhere in this region, and now I feel like I'm getting more like perhaps 6 inches. So, yeah, I feel like that did change.
Yeah, feels it.
Let me take over the camera, and let's just have you walk up and down the hall and see how you feel. I'm amazed at the dogs being well behaved. This is a home office, and we have 2 dogs, and usually they're quite active when people come over. So your thoughts?
It feels like there's more motion in the knee when I'm walking.
Okay.
So that feels like it's not quite as stiff.
Okay. And then go ahead and go sit in that chair and then stand up. Person I treated yesterday noted that he was then able to do a squat without pain. And I don't know that this will tell us anything, but let's just try it. And sit down again. Thoughts? Hard to tell?
Hard to say.
Okay, so go ahead and elaborate. So when you're walking, you feel like the knee is a little bit freer?
Yeah.
And in any specific direction?
It just seems like the flexion, it's...
Feels like it bends easier.
Yeah.
Interesting. And it may help the hip mobility on the opposite side, because the body does compensate. If you have stiffness on one side in one direction, on the opposite side of the body, you do tend to compensate reflexively. But anyway, I think we'll stop filming here. And
It doesn't feel as tight when I try to go down like that.
Aha, very good. Yeah, that was the same effect with the other person when he squatted, and he also had less pain. So I'll stop here. Thank you.